So when we talk about Adams Memorial Hospital rehabilitation, we often mention that all of their therapy is backed by the strength and resources of a full community hospital. Angie and Judy here to explain this continuum of care, and really it can start with right when we come out of the hospital, right?
Yeah, so we actually provide services to the patients in our hospital as well. So while they're an inpatient in our hospital following an injury or surgery or any type of illness, if the doctors think that they need therapy so they don't get weak while they're there, we'll actually go up to the room and treat them there. But then once they're discharged, they may not be ready to go home for a number of different reasons. It may be that they're too weak to go home, that they're a fall risk, that there might be some cognitive issues, so they're not making safe decisions, and so they need some more assistance. And so if that's the case, then we'll all kind of work together, and everyone that's working with that patient to make the safe decision as possible for them following that discharge. And so we actually have several options for treatment following discharge. One of them would be if they are safe to go home, they could come in for outpatient therapy if they just need a little more strengthening. But then the other one would be like if they still need some assistance, they would need to either go to another facility to get some more therapy and some nursing care. So we actually have 3 different locations where we offer that. One is actually in our hospital, and it's a swing bed or a skilled bed. So somebody could stay on potentially at our hospital or come to us from another hospital and get that nursing care and usually 2 to 3 hours of therapy a day. And then we also have 2 nursing home facilities, one located in Monroeville called Adams Heritage, and one located next to the hospital in Decatur called Adams Woodcrest. And the same services would be provided there as well.
Yeah, I mean, again, it's important because the last thing anyone wants is to go home too early and then have whatever injury, you guys just fixed at the hospital reoccur.
Yes.
That's not good either. And that's not the only level of care in this continuum of care, right?
Right. So not only do they get a good rehab experience when they get to hopefully get back home again, sometimes we find that as our parents or our grandparents age, we find some cognitive issues that become more apparent. Cognition is defined as how we think, like memory, attention, problem solving, and sequencing. And those things work together, such as, maybe you're finding that your parent is not maybe taking their medications on time because they forget or they don't have reminders, and some of the problem solving skills are a little bit lessened or impaired. So we have some comprehensive testing that we do in the nursing home between occupational therapy and speech therapy. They do these tests, and then we get a level of where this person is so that we can provide some maybe cognitive retraining or educate the family on what kind of resources or compensatory strategies that may be helpful to get them home and functioning at their highest possible level again.
Because I think a lot of times we may think of therapy as just physical. It's obviously cognitive as well, right?
Right. There's many different levels of cognition, and so it's a thing called Allen cognitive level. And one level might mean that they need 24-hour care. Another level might indicate that they can be home alone, but they need daily checks. Or maybe someone has to come in and set up their medications for them. Maybe their meal prep isn't what it used to be. They're making mistakes, so maybe they can use a microwave safely, but not use the stove anymore.
I'm sure somebody right now is asking themselves, can I do this on behalf of, can I sign you up to assess somebody who maybe isn't necessarily 100% willing?
The testing is done typically in a nursing care setting.
Okay.
We can do it on an outpatient as well, but the best testing is done over the course of a period of time, like different times of the day, over several days. We want to make sure that the person is clear of infection. Maybe a medication has impaired them.
Full test.
Yeah, so we want to see them over time so that we have the best level for them, and so we can provide the resources.
There's a ton of resources and a full continuum of care. They're not kidding. At adamshealthnetwork.org is where you can find out more online. adamshospital.org if you want to learn more. We will be right back on Insight.